to my channel, I Lit a Candle presentations for the XJW community. This is my fourth YouTube and my third in a series on mental health and Jehovah's Witnesses. This YouTube will focus on medical doctors and alternative care providers. If you have not already seen my previous videos on this subject, it would be good to stop and do them in order. Before I start, I'd like to say that I have made a page that will be at the end of this YouTube video. It is a list of many of the resources that I'm going to talk about in this YouTube, so I won't have to give the web addresses and such information by voice as I'm going along in this YouTube. They will be on the last page, and there they will be correctly typed and legible. So if you're interested in benefiting from these resources, you're going to be able to see them clearly on the last page. The last time I talked about hotlines and what is available. I want to mention again the webpage Please Live, which has an extensive list of hotlines that are dedicated to very specific issues and can be very good support. But I forgot to mention the XJW hotline specifically. I can only comment on them that I did call one several years ago and had a very lovely conversation with an XJW. She had gone through some of the things that I was particularly going through at the time. I remember she talked about how hurt she was, that her mother had totally turned her back on her when she left the organization. I can't really remember if she was disfellowshipped or had left and disassociated herself, but I could hear her pain. Her mother had totally disowned her and disinherited her, and so there was a lot that I could relate to. She was very empathetic, and it was very helpful. The fact is that many of us are seeking validation, and it's really good to have somebody to talk to has been through the things that really only Jehovah's Witnesses can understand, I think. As I said, for years, many people would ask about things, but I know only Jehovah's Witnesses can really understand what other Jehovah's Witnesses have been through. In fact, we can hardly believe it ourselves sometimes. So that is one thing that we do have here is a support group on the XJW community. Well, it's been a long grind and process. Yes, grinding us down. So as I said, it is good that we do have this community. We do have a support group. And there's many things that we are still puzzled about that we have been through. But I am so thankful to see that despite the pain and suffering, so many are reaching out just with compassion. So even though we do not always agree with the conclusions that some have come to once they are out and they're no longer controlled by that organization, I still see such compassion and concern. And this is really a wonderful thing. I must say that sometimes I'm going to sleep and it's just good for me to turn on my iPod and listen to the voices of some of you. Some of you have wonderful voices. The quality is just very comforting and kind of says to me, this is the voice of sanity. I cannot vouch for every XJW hotline that is out there. There might be a problem with some people, and you may want to use some caution and use good sense. There is a tendency among some people to be a little naive, and they want to find hope, they want to find an answer, and they can be a little bit gullible. So be cautious and use good sense. I do have a few axes to grind myself. One thing is that I believe people should educate themselves a little more in the medical field. I know this can seem impossible or difficult, but there are many good books out there written for the layman today. And I would suggest if you're not familiar with the medical field, it would be a good time to start somewhere. I've often thought I would like to give some lectures on the YouTube to lay out the basic groundwork for understanding medicine, the medical field that is out there. And perhaps one day I will get around to it. Think about this. You may be a normal person who has a bank account. Would you just openly want to entrust your bank account and your money and all your possessions to someone you hardly knew and just let them tell you how much you have in your bank account? So would you give your doctor a blank check every time you saw him and let him fill in the amount to be paid? What is really more important, your money or your life? So all I'm saying is start informing yourself. I know that people want to trust their doctor, and it's a good idea to have a good relationship with them. But it is also possible to have an alternative care practitioner. Many of you probably know that there is a certain tension and even downright hostility between alternative care providers and medical doctors. Now, I'm in California, and we are a health freedom state. And this hard-won freedom allows us to choose who we go to for medical care. However, we know that a lot of practitioners of alternative care are not covered under their insurance that people have. And I think it's really downright silly at times that they will go to a medical doctor just because they are covered, rather than an alternative care practitioner who really may charge just the amount of that person's deduction that they would get at the medical doctors. Anyway, it is a dangerous situation at times to put too much trust in the current medical system. So I would totally recommend getting, first of all, some type of naturopathic doctor involved in our care, especially if there is a mental issue. They can give you a different perspective at times. For example, people should be checked out, of course, completely. We know that people who we care about at times have seemed to change mentally and emotionally. They may become agitated and short-tempered, and it's not just they are not being themselves. So they need to be checked out for different things like diabetes, hypoglycemia. These are all things that can cause mental symptoms. And sometimes there can be other organic disease involved. Now, medical doctors are supposed to do this. Sometimes their procedures are more invasive than we would like. So it is also good to see what a naturopathic doctor can offer at times. So many people are not familiar with naturopathic doctors, and except for the surgery training, many of them are very well trained and as completely as medical doctors. The fact is, the allopathic medical world is the most powerful, as it is backed by the pharmaceutical companies who provide the money for the medical schools and continue to pump up the prestige that they have in various ways through money. It really has nothing to do sometimes with the facts at all. Most people are used to dealing with allopathic doctors. Many alternative practitioners have to tread lightly and be careful not to rock the boat, as they are the ones that often end up being attacked. The fact is, even your standard medical doctors are expected and have to legally abide by standard of care and many other rules put out in the medical system. Even if they totally disagreed with what they have come to experience and see in their practice, they really have their hands tied. What does this mean for you? Ultimately, you are the one that is responsible for your medical treatment. It is up to you to decide what to do. So do not let medical doctors intimidate you, but do show respect and ask enough questions. Another type of medical theory is one that is known as homeopathy. I've seen many people with mental issues respond very well to homeopathic treatment. For example, I saw a lady who was crying for months, who was even on medication. Actually, very short time, was able to stop crying with one remedy. And it seemed to be a good remedy for her throughout trying many others. We had to keep going back to that one. There is a lot to know about homeopathy, but there are remedies for people who are extremely angry. There are remedies, as I said, for people who can't stop crying. There are remedies for people who are jealous and abusive. There are remedies for people who worry too much. There are remedies for people who talk too much. And there is remedies even for such things as religious insanity. Now, all homeopaths will admit and realize that not everything can be cured or ameliorated, as we say, with homeopathy. There is a real need for the care of medical doctors sometimes, and that is just something that cannot be avoided in some cases. However, sometimes the homeopathic remedy can ameliorate or help the toxic effects of various treatments. But I want you to know there is an association of homeopathic medical doctors, and you need to understand not all homeopaths are medical doctors, but there are medical doctors who are homeopaths. Also, you may find that a clinic specializing in homeopathy has a doctor working with it, a medical doctor. Now, I put on the last page a list, and on that list is the name of Dr. Peter Breggin. Now, he is a man I'd like to sing his praises. He is a psychiatrist, so he is also a medical doctor, and he is a homeopath that really speaks up very loudly and clearly. Now, he has written some amazing books. I'd like to just name a few. Psychiatric Drug Withdrawal, Toxic Drugs, I think, something there, Medication Madness, Guilt, Shame, and Anxiety, a book called Ritalin, Talking Back to Prozac, Brain Disabling Treatments in Psychiatry. Anyway, I want to get them all. I believe he also has a podcast, and he does do interviews. He has done many interviews. And he is also used as a special or an expert witness at trials. There are many cases now being brought to trial that show these various pharmaceutical drugs were the cause of many bad things with people. Oh, I also want to mention right now the book Prozac, Panacea, or Pandora by Anne Blake Tracy and published by Cassia Publications. This book is very well documented and shows very clearly the link between people who have killed themselves and their children. Of course, not all cases, but in some cases, in fact, quite a few. And also other murderous behaviors, suicidal ideation, and compulsions to kill. Recently, the government gave out a warning requiring these drugs to come with a warning that they will actually increase your risk of suicide and cause depression. So it is not necessarily a good thing to go to the doctors and all they have to offer you are these type of medications. Right now, I want to say that I have seen and I know how horrible a time people have coming off of these drugs, trying to get off of them. It is almost impossible. And I certainly would recommend that you do not try to do so on your own. Although I do know of at least one case personally where a woman did take herself off Prozac after being on it for about 16 years. This was something that was her decision totally. So if that is your desire to get off of drugs like Prozac, I have also seen people who tried to do so with their doctors, and their doctors would not cooperate with them, and in fact gave them higher and stronger potencies of these SSRIs, which is what they are. It is a whole family of drugs. These doctors are also very sneaky. And as I said, people do not educate themselves. I know of a lady who was told by her doctor, okay, well, I'll give you this. He then put her on Zoloft, which is the same thing, really, virtually, much stronger, at a much higher potency. And she did not even realize this first. But he certainly did not respect her wishes or desires. This book clearly shows that these drugs do not do what they say and do not they will actually create more havoc in the body. So it is not really the answer that many people would choose to have. Now, believe me, I have had personal experience with a family member over many years, 17 years, and I wish I knew then what I know now. Unfortunately, it was too late. People who are on these drugs, first of all, will develop a terrible craving for alcohol, and of course this leads to alcoholism. This is exactly what I saw in this man. They will also develop, in many cases, this is actually the history, diabetes, tumors on the pancreas, and this is exactly what happened to this man. Recently, this man had 5 major blockages near his heart and had to have open heart surgery. This man did not even stay on his medications of Prozac and Zoloft over the years. He was not on them on a regular basis, and probably not on them at all for at least the last 18 years. However, it still caused the damage, I am sure. Also, the fact is, as I said, these drugs produce sexual dysfunction. Now, how frustrating is that? The fact is, it is interesting. As I said, people do not educate themselves, so what do? They blame this on somebody else, all these different things. So what good does that do? It is very illiterate. It's very, not smart, but it is human nature. So it's time to really open up ourselves to education and look at other causes than just always blaming somebody else. As I said, Prozac and all these other drugs really do not do what they say they do. From my experience, and I observed this very closely. I saw that this man who had been actually taken in on a hotline call had been put on lithium. It ended up being massive doses of lithium, yet he was supposed to be monitored as this can be very toxic, and he never was monitored. Then, a fact is, too, he was in a county facility off and on, and that is not the best place sometimes to get care. Eventually, this person was put on Prozac. Now, this did produce a change, but I can't say it was for the better. He got very silly and then ultimately would alternate between the silliness and being extremely angry, manic, and have regular rages every 3 months. And of course, generally unreasonable. This went on for many years. But the people themselves sometimes feel that the drug helps them, but it is really short-lived. And the actual effect, as I now understand, which I did not then at the time understand, is that it affects them a lot like cocaine or speed. So of course they love it, but when it comes, a time period goes by, really, it bites them in the ass. So what do we do besides throw our hands up in despair? The fact is, the medical system in many cases is killing us. And the fact is that doctors themselves right now, it's spoken of as an epidemic of doctors killing themselves. So there may be a lot of reasons for this, but ultimately it is some type of despair. But rather than being in despair, I would like to offer, as I said, alternative care providers. Now, there are many practitioners of various modalities that have been around for thousands of years, and they have great success in many cases. So I'd like to turn the spotlight on another fact, and that is that people seek to self-medicate in many ways, or to get medication. As we have seen, it can be everything from sex addiction to alcohol to various drugs, and now, what do we see? Addiction to video games and things like this. What are people really trying to do? They want to change their mood. They want to feel good in themselves and about themselves, or just simply understand themselves in a way that they can handle. And usually it is through some type of substance because it needs to be fast. So they may do this on a self-medication basis or allow and give permission to their doctor to give them these drugs that they feel are the best solution. Now, I will say that homeopathic remedies do have the ability to change the mood, but it is a more healing process, and it is working in a way that the body works. This is the thing. When you're taking synthetically made, very strong substances, you're not treating the body in a holistic way. What you are doing is poisoning it, and your body knows that. Your body knows when it is being poisoned, whether it's on a conscious level or a subconscious level. So what do you think your body feels about being poisoned? This can even happen with various herbal treatments. Homeopathy, on the other hand, does not become toxic. Many of us are familiar with acupuncture. This is another form of holistic care that should go along with herbal treatments. A Chinese medicine practitioner should be skilled in acupuncture and herbal preparations. Now, there is another form of alternative medical care that is out there now, Ayurvedic. I am not terribly familiar with it, but I do know a practitioner, and of course, we are familiar with some of the great doctors who have written many books. I think of Deepak Chopra, and of course he is from India, and I'm sure he's very familiar with Ayurvedic. I don't know how much he uses that in his practice now. He probably does use a combination of things. Many of us think that, we've heard of talk therapy, and we're not aware that there are maybe different approaches to that as well. These professionals, they certainly have had some training. They have been educated, and they've also been able to observe patterns, and they could perhaps offer some really valid methods and counsel. There are also differences in the psychiatric counseling field. There is behavioral modification techniques and many different things that people could benefit from using these type of people as a form of an option that is being used by many. But I must say that I have not observed a great deal of success. I've seen people who were going to therapists for 10 years and they still did not resolve a lot of their issues. And I feel that a lot of them could have been helped with homeopathic remedies or a combination of therapy and homeopathic treatment. Another thing I want to speak very highly of and recommend is what used to be called REM therapy. It is now called EMDR. It's eye movement desensitization, and is especially highly effective in post-traumatic stress disorder. There are people who specialize in this who are psychologists or have some type of specialized legitimate training, and I would only recommend them to go to. I will insert here that I did attempt to have this type of therapy at one point, and I could not afford the professional therapy. I was told about a woman who did this type of therapy, so I went to her place, and I can tell you this is not a good idea. She's not at all trained, and she started talking about the fact that she had multiple personalities and a lot of other things. So I got out of there, and I never did end up being able to try this therapy. I did, however, find a very successful way of treating it with homeopathic remedies, although I would still really have liked to have done the REM therapy. There are, of course, many other types of respected alternative practitioners. They may have different ideas than the mainstream medicine, but they can be well worth looking into. And I've also seen a lot of charlatans that are not worth your time or your money. Now, this can be just as true in the standard medical care doctor field as well as the holistic field. I am not a person who believes in the methods used by Christian Science, but I do believe that prayer should be incorporated into a person's care, and also people should act in harmony with their prayers. I have realized over the years that when people are prayed for by a group, or when people pray for other people, it seems to have more results than just praying for yourself. I looked into this seriously, and at one point in my life, this is what I noticed. I would like to say also that I have found that the witnesses in general do not come over and pray for people, not even on their elders' visits. So please don't look upon prayer as being unimportant or ineffective. But of course, it is important to work in harmony with what you are praying for and to continue to examine the situation. So I want to say now to people, please don't despair. If you are a person who does not have money to go out and hunt down doctors and a lot of money to try out all these different things, pray and talk about your issues with people in the area and see what kind of resources come up. I have seen people who had money spend all their money and lose their home and go on nationwide searches for doctors when the answers were really very close to home and much simpler. Now, finally, for this YouTube, if you are afflicted and you have to rely on medical care through medical doctors, do not despair. You are certainly not alone. And some have managed to find a way through this maze. And even though it is exhausting at times, there can be answers. And that is the thing. There cannot be no answer. And realize that you are certainly not alone in this struggle. And who knows, maybe you will have something to contribute through your experience of going through all this. So now I would like to say that there are many, many things that people can do to contribute towards better mental health in themselves, in their family, and they are not going to cost you a lot of money or send you to the doctors. There are so many, many of these simple things that I would like to do another YouTube on this, which will follow on the simple things and mental health.